I'm going to talk about the YMCA graded cycloergometer cardiovascular testing. The purpose of the YMCA graded cycloergometer testing is to figure out what someone's estimated maximum workload is, specifically in kilograms, which is done by taking what the workload is and kind of graphing it and kind of seeing what that estimated max is. Overall, the YMCA graded cycloergometer test is done in stages. It's done in 3-minute stages. You record the heart rate and the blood pressure at the end of the 3rd minute. So at the end of every stage, you take the heart rate and blood pressure measurements. After you do the vital check, you should always ask the client, do you feel well enough to continue? Kind of just checking in on their perceived rate of exertion and seeing how they're doing. Part of also checking the vitals, and rather than just obviously ensuring that they're doing okay physiologically, it's also to figure out as to how much you increase the intensity for the next stage. And it's all based off of their current heart rate, which basically just says how well are they currently handling this test. So if the client is 80 beats per minute or under, you would only move it up 0.5. You go 0.5 up to 2.5, and this is all within the first stage. If they're 80 to 95, you'll go from 1 to 2. If they're from 90 to 100, you'll go from 1 to 2. And if they're greater than 100, just equals 1. So basically, it just basically says, obviously, the lower their heart rate is, the more you can try and kind of push them. But if their heart rate's a little high, obviously you don't want to continue pushing them because it's a sign that the body is already kind of struggling with the current protocol. Also, an important part of this test is that it's done at a specific cadence. So the workload is that of them having to maintain 50 RPM. So that is how quickly they are cycling. And the way that the intensity is magnified is by actually increasing the tension, the resistance of the wheel. So they maintain that same 50 RPM, but the resistance of the wheel gets greater after each stage, to kind of figure out and kind of push them to see when does the body hit that point where it starts struggling, to kind of figure out that maximum workload.